Hello, everybody. Welcome to Wednesday Live with Dr. Nancy. We should have a big turnout today because of the cold weather. I'm assuming everybody's home cuddled up in front of the fire with their blankets and their kids. And just waiting to hear about infant reflexology today. So I have a couple announcements. First of all, we are in the office. So we will be here until 6, our normal hours. We've had some patients come in and brave the weather, and we were happy to see them. We've got hot chocolate, coffee, and some gluten-free, dairy-free cookies out here. So if you need an adjustment, come on in. And then also, we are holding a raffle in the office to benefit, it's called Oklahaven. It's in, I think it's Oklahoma, but it's a clinic for special needs kids. And the doctor down there works on children for free, and she's close to an airport. So people fly in and get treatment, and they stay there for a little while. And it's all not for profit. She works solely on donations. So right around February 14th time, the chiropractors like to get together and help support her. So we're going to hold a raffle. Tickets are $10, and you can win a $60-minute massage. If you just want to give from your heart, we'd appreciate that too. But as an incentive, we're selling raffle tickets for $10, and then the proceeds will go to Oklahaven. So if you have a heart and want to help, we may even put a link up on our Facebook page if you want to donate from there. So we would appreciate you helping out this wonderful doctor who's helping all these kids. So today we have Tess Williams, who is she's a doula, but she's going to talk to us a little bit about infant reflexology. But I want her to introduce herself to all of you and tell us a little bit about yourself. Welcome, Tess.
Well, thank you, Dr. Nancy. It's nice to be here. I've been a birth doula for 10 years now. And along my journey, I decided to become certified as a reflexologist because I could see the benefit of how that could help a pregnant mom, a woman in labor, and sometimes postpartum. And then I think it was about a year into my journey that I had a young mother that I had been doula for who got a hold of me and said, "My baby has horrible colic, and we have tried everything. Is there anything you can do?" And I went, "Bring him over and we'll try." So she brought him to my house, and this was a child who didn't even like being in his car seat. He would scream when they put him in the car seat, and he would scream every time they laid him down on his back. So I said, lay him down on the couch, and I started rubbing his digestive system and his stomach reflex. And when she laid him down, he was just screaming and kicking, and she said he really doesn't like being on his back. Mm-hmm. Babies take very little stimulation because their nerve endings are right there. And I'm rubbing on these, massaging the areas, and he started passing gas.
Oh, wow.
And within 5 minutes, we had a smiling, happy baby who was cooing at us. And she was like, "Oh my gosh." And I thought, I should probably be doing more of this. So I showed her, use hypoallergenic lotion because he's so tiny.
Yeah.
And here's what you do. And she went back and told some friends, and that kind of got more people coming, going, "Okay, my baby this, my baby that." Sometimes babies have birth trauma because it was a long or difficult birth. There might have been forceps used. Sometimes it's an induced birth, which produces stronger contractions. Sometimes it's a cesarean birth. And I had always referred moms who contacted me and said, "My baby's it's like he's in pain. What's going on here?" I've always said, "Okay, let's get him to Dr. Nancy," mm-hmm. because she works on newborns. And then I got doing some further study, and it was like, well, I know that chiropractic works wonderfully for colic, for birth trauma, for breastfeeding problems. And it's like, okay, sometimes it takes several treatments, and the reflexology is complementary to that because I can massage the areas of the spine, the neck, around the head, that also helps relieve pain and helps the baby to heal more quickly.
Exactly.
You're right. Mm-hmm. And that's our goal.
Yes.
Like I said, it works great for colic. It also works well, like if baby's teething. There are reflexes on the top of the head and the top of the toes that relate to the mouth, the jaw, and all this. And we have found that if you are massaging those areas for just a minute, maybe once or twice a day, it helps the baby tremendously with their teething problems. Sometimes because of the way the baby is positioned in the womb or because of traumatic birth, babies will have, moms will have breastfeeding problems.
Right.
And I'm also a lactation specialist. So I've had instances where I go visit the mom because she's like, this baby won't latch. She fights and screams. And I go and it's like, it's hurting her to be turned that way. It's like the baby would breastfeed off one breast, but not off the other. And it's like, okay, let's get to a chiropractor and get some work done here. And we'll also do some reflexology to help with this. And I will show you where to massage to help this baby release those muscles and that tightness so that we can improve this breastfeeding journey.
Yeah. So for the people that aren't familiar with reflexology, can you explain kind of what it is you're doing or what it is?
I'm basically rubbing feet. My friend jokes that I birth babies and rub feet.
I love it. It's as scientific as I get.
Yes. It's like the theory behind reflexology is your nerve endings start in your brain, go through down all your muscles and organs, and land on your feet. And babies' feet are particularly sensitive. And I wish I had a chart to show you. Wait a minute. Here, can you see this?
Put your foot up there. There you go.
Baby's foot. Yeah.
All right. Let me hide your name real quick. Oh.
It's okay.
Yeah.
The different colored areas on there are different reflexes. So, for example, this blue area here is lungs. And right up under there are the eyes and ears. Up here are sinuses. And then the pink going across there is kind of the head, neck, etc. And down in here where this purple area is, that is like the stomach, and on both feet, the digestive system.
Okay.
So when you massage those areas or put acupressure on those areas, it helps release the tension and helps relax the baby and stop the pain, quite frankly. So that's just kind of what we focus on. It's like, babies get sinus infections sometimes.
Yeah.
Work on that.
Yeah.
Babies get colds. And when they get congested and their sinuses are congested, it's much harder for them to breastfeed because they can't breathe.
Yeah.
So, we say, okay, steam inhalation, blah, blah, blah. But also, let's massage these for 1 minute to 5 minutes on each foot. And that will help the body get back in balance. Yeah. That's what all alternate medical therapies are, is getting the body back in balance and getting rid of dis-ease.
Yes. Yes. Amen.
So that's what we work on.
Yeah. So can you work on a foot and like feel where the area is that's the issue? Do you feel little balls, or do you feel something where you can say, oh, they're having a problem in their lower GI, things like that?
Yes, many times you can on both the adult foot and the child's foot. Okay. Children's feet are much easier, partially because they're smaller, partially because it takes less time, but partially because the nerve endings are right there and you can feel things. We call it tonus or crystals. Okay. And it's just like a little bump there. And you go, oh, there's where the problem is. Okay, let's work on that a little bit.
Oh, nice. Now, do you teach parents how to do this, or do you just do it yourself? Or
my theory is teach the parent how to do it, because I can't come at 2:00 in the morning and rub your baby's feet, so you need to know how to do this.
Yes.
And that's always been it's like, okay, we'll do a session. I'll show you how to do this. Let you practice for a minute or so. And then, yes, you do this on your baby yourself.
Great.
It's kind of like teaching baby massage. We have people that do that.
Yeah.
I view it the same way. The
Okay.
parent needs to know. And the advantage of reflexology is you can do it any place. You could be in the car and the baby's in the car seat and you're sitting beside him, do it.
Yeah.
You're out at a picnic or you're at the ballpark watching your older child play ball. You can
Yeah.
do it right there.
Right.
And all you have to do is pull the sock or shoe or whatever off and go for it.
That sounds awesome. So,
It Go ahead.
and it's on the bottom of the foot, right? Not the top.
Well,
Or can
no,
you
it's not. You work both sides really,
okay.
because the top of the foot has got lymph nodes up there, and the face is actually on the big toe, all around the toenail. So you're working on that, and then working on the other nails
Oh, okay.
to help with like teething and things like that, or when they're particularly tight in through here after
Uh-huh.
a traumatic birth, that kind of thing. So yeah, the back of the neck is on the back of the big toe, but the throat is on the front.
Oh, okay. That makes
So
sense.
yeah, so yeah, we work both sides because up around the ankles, if they're having like hip problems, which sometimes babies have,
Oh, yeah.
that's you work around the ankles there to help relieve that. You work up the side of the foot, which if this were the big toe, um, you're
There you go.
coming up the side of the foot, finger walking it,
Hmm.
and that's the spine. So you're
Okay.
really working all areas of the foot. You
Great.
just don't do it for a long time.
Oh, so when you said you were working the head earlier when we were talking, were you actually working the head or the part of the body or part of the
Uh,
foot for the head?
okay. For the head, I was working the top of the toes.
Okay. Okay.
So, and then for the face and the jaw and all this, it's around the side of the big nail and the side of the toe
Oh, okay.
on all the toes.
Okay. I thought reflexology had traveled up to the head when you talked about that earlier. It's like, that's new
So
to me.
it's okay. There are methodologies which I have learned where you can actually do reflexology on the hands or on the ears.
Oh, okay. Yeah.
So sometimes for adults, I use those. For a
Yeah.
baby, I think it's too intense.
Yeah. I know they don't like it when I touch their ears either. So
Like, what are you doing?
I know. I'm like a psychic. I tell the parent, I go, they're not going to like this. They've been happy the whole time. Then when I go to their ears, they start, they
The
don't
parents
like
are like,
it.
how did you know that?
I know. I'm psychic.
There you go.
Yeah. So hi, Anna. She said that you've helped two of her babies with
Yeah.
reflexology.
Hmm.
Oh, that's
Helped her during
awesome.
pregnancy and then helped the babies.
Yeah.
So,
She said when they
yeah.
were sick or they were teething that you've helped her through that. That's awesome. She's got a
Yeah.
lot of them to practice on.
Yes, she does. Yes, she does.
While we're chatting away, does anybody have any questions for Tess about infant reflexology or even her doula services or lactation questions, anything like that? Do you work out of just one hospital or do you travel to other hospitals?
I go to all hospitals.
Oh,
I've
do
been
you?
to Lafayette, down to Shelbyville. I actually work for Community Health Network, and I work at all three of their Indianapolis hospitals.
Okay.
But I also have private clients, and wherever that client is birthing, whether it's home, hospital, the birth center, whatever, I go there.
Okay. Great. I just saw a post from the birthing center that they were promoting doulas and how it's important to have a doula, even if you have a midwife. That having a doula there is great too for support.
Hmm.
So
Midwives, I love working with midwives, I have to tell you,
aren't they the
because I love
best?
natural birth.
Yeah,
But they have a different role. I have a lot of people ask me, well, are you a midwife? I'm like, no, I'm a birth doula. Well, what's the
yeah,
difference? I don't do medical interventions.
yeah,
I'm there for support and comfort. And yeah, reflexology and aromatherapy works into that,
yeah.
but it's a holistic approach. I'm not going to catch a baby.
Right,
And I
right.
don't know how to check a cervix, and I'm not going to try.
Yeah, exactly. I keep asking for a doula. My daughter's almost 16 now, but I still would like a. When I heard about this postpartum doula career, I was like, I would still like one of those. They, they vacuum and cook and things like that, right?
Yes.
I'm going to hire somebody.
I think it sounds like an excellent idea. I would
I
have
know.
loved to have one when my kids were teenagers.
I know. It'd be nice.
Yes.
Oh. So we don't have any questions. Do you have anything else that, I've got that thing in my face again. Anything else that you'd like to add that I didn't ask you about, or any information you want to share with the parents out there?
I can't really think of much of anything other than just, if you realize your child is uncomfortable, then let's try and do something to fix this and help them better. But other than that, I'm open for births.
Okay. And I threw your website up there. It's covering my mouth. I'll have to go on top of it. I tell you, working with this computer stuff is really interesting. It's, my little box is blocking, so I can't remove my name. So,
Oh my gosh.
but her website is gentlehandbirthservices.com for anybody listening on the podcast. And Tess is wonderful. I highly recommend her. For anything, like, for birthing, for lactation, for aromatherapy, you are doing it all, I tell you.
Well, thank you.
Infant reflexology. Do you ever do workshops on that?
No, I never thought of that. That is a good idea.
That would be great. We need to chat. That would be a really neat workshop, I think, for moms to learn.
Hadn't thought about that. That's a great idea.
All right.
Thank you.
No problem. We had a workshop a couple weeks ago, and when we were supposed to get all that really bad snow on a Saturday, and we canceled it and did a Zoom call instead. But there was no snow. We could have totally done it in the office. So, but I would love to see an infant reflexology workshop. That'd be really fun.
Okay, that would be fun. Let's talk about that later.
All right, we'll do that. So we still have few viewers here. You have a lot of fans. Any questions out there for us before we sign off today? Everybody's hands are cold, so they're not typing so much.
They're not typing, yes.
Yeah. Well, Tess, thank you so much for joining me. I really appreciate it. It was wonderful to talk to you and to see you. I haven't seen you in a while, so this is great.
No, I haven't seen you since the Birth and Baby Expo.
Yeah.
So it's really nice seeing you.
Yes, you too. Well, stay warm today. And everybody watching, stay warm. And again, we are open. If you need to come in, we'll be here. And have a wonderful, warm day.
Thank you.
Thank you, Tess.